Hello, my name is Sumilola, and today my group and I will be discussing obesity in children, including its causes, complications, and what can be done to reduce childhood obesity. First, let's discuss what obesity is. The World Health Organization defines obesity as abnormal or excessive fat accumulation that may impair health. Obesity can cause day-to-day health problems such as back or joint pain, fatigue, increased sweating, and an inability to cope with sudden physical activity. The Centers for Disease Control and Prevention uses a weight to height ratio called the body mass index, or BMI, which is used as an indicator to know if an individual is underweight, within a healthy weight range, overweight, or obese. The word overweight is often used in the same terms as the word obese. In medical terminology, overweight is used as a noun as well as an adjective to indicate that overweight and obesity are a part of a disease process. The difference between overweight and obesity is based on body mass index. Overweight is defined as a BMI of 25 to 29.9. A person who is obese must have a BMI of 30 or higher. 41 million children under the age of 5 were overweight or obese in 2016. That same year, over 340 million children and adolescents aged 5 to 19 were overweight or obese. In the United States specifically, the prevalence of obesity was 18.5% and affected about 13.7 million children and adolescents. The prevalence of obesity was 13.9% among 2 to 5-year-olds, 18.4% among 6 to 11-year-olds, and 20.6% among 12 to 19-year-olds. Childhood obesity is also more common among Hispanics, which is 25.8%, and non-Hispanic blacks, which is 22%. It is important to know that obesity is a disease caused by a complex interplay among factors such as genetics and environment. Now, we will have Nicole, who will discuss what the causes of child obesity are.
In this portion of the video, we're going to discuss the causes of obesity in children, mainly focusing on the health and nutritional factors. So the first factor towards childhood obesity is improper dietary intake. This refers to children consistently eating foods with a high number of calories, especially fatty calories, such as fast food, fried food, junk food, or baked goods. Also, an increased amount of sugar intake can increase their chances of becoming obese as well. Studies show that the consumption of sugary beverages and foods increase body mass index over the years, little by little, that you won't even realize it's having an effect on your body until the damage is already done. This is why it's important to focus on the child's portion sizes when you're feeding them. So if you're feeding them a meal of higher calories or that contains higher number of calories, you want to give them a smaller portion so it's not having a drastic effect on their body. Another factor towards childhood obesity is the parents themselves. Now, this kind of ties into the previous factor of dietary intake because the parents are the ones that are providing food for their kids and providing and choosing what their children eat. So it's important that if you're giving your children a meal that has a high number of calories, you focus on giving them a smaller portion size, and you also give them a side of fruits or vegetables to balance out their diet. Referring back to sweets and sugar intake, when children eat foods that contain high amounts of sugar, this triggers the release of endorphins in their brain, which encourages them or makes them crave more of it. So that's why it's important for parents to have discipline over their children of what they eat, because if they have no discipline towards food intake, children will continue to eat fatty foods that gives them pleasure, which will undoubtedly increase their risk of developing obesity.
Hi, my name is Claire Villagra, and today I'll be discussing what other issues can develop in obese children. There are many health factors that are negatively associated with obesity, and if not taken care of, they could lead to potentially dangerous conditions in the future. Many obese children have increased levels of cholesterol or high blood pressure due to their poor diet. But in bigger concern, they could also develop type 2 diabetes. The Center of Disease Control and Prevention estimates that 1 out of 3 American children born in 2000 will develop diabetes in their lifetime. Another condition that could arise from obesity is metabolic syndrome. Metabolic syndrome consists of insulin resistance, high blood pressure, lipid abnormalities, and obesity. About 25 to 40% of children already contain this syndrome. Overweight children could also develop obstructed sleep apnea. Obstructive sleep apnea is a potential life-threatening breathing disorder that interrupts breathing during sleep, and if not fixed or if prolonged, it could lead to heart failure. Children are also prone to develop psychological issues, such as depression, high anxiety, and stress, because obese children are more likely to be teased or bullied, and their behavior could change, and they could also have learning problems. If weight is not maintained in childhood, it could lead to serious conditions in adulthood, such as stroke, heart disease caused by atherosclerosis, liver disease such as non-alcoholic steatohepatitis, which is the increased fat production in the liver that will cause inflammation, and dementia.
Hello, my name is Tanya Santos, and I'm going to talk about what healthy alternatives can reduce the chances of obesity in children. One part of balancing calories is to eat foods that provide adequate nutrition and an appropriate number of calories. Parents can help children learn to be aware of what they eat by developing healthy eating habits, looking for ways to make favorite dishes healthier, and reducing calorie-rich temptations. Families should develop healthy eating habits by providing plenty of vegetables, fruits, and whole grain products, including low-fat or non-fat milk or dairy products, choosing lean meats, poultry, fish, lentils, and beans for protein, serving reasonably sized portions, encouraging to drink lots of water, limiting sugar-sweetened beverages, and limiting the consumption of sugar and saturated fat. Although everything can be enjoyed in moderation, reducing the calorie-rich temptations of high fat and high sugar or salty snacks can also help children develop healthy eating habits. Examples of easy-to-prepare low-fat and low-sugar treats are a medium-sized banana, apple wedges and whole grain crackers, 1 cup of grapes, or 1 cup of carrots, broccoli, or bell peppers with hummus. Another part of balancing calories is to engage in an appropriate amount of physical activity and avoid too much sedentary time. Children should participate in at least 60 minutes of moderate intensity physical activity most days of the week, preferably daily. Some examples of moderate intensity physical activity include brisk walking, playing tag, jumping rope, playing soccer, swimming, and dancing. In addition to encouraging physical activity, children should avoid too much sedentary time. Although quiet time for reading and homework is fine, time should be limited for watching television, playing video games, or surfing the web no more than 2 hours per day. Instead, children should be encouraged to find fun activities to do with family members or on their own that simply involve more activity.
Hello everyone, my name is Francesca and I will be talking about parent education from nurses about obesity. Professional intervention can help lower the risk of children developing unhealthy eating habits that can usually be mimicked by those surrounding them. As seen in studies, childhood obesity can be directly attributed to severe physical and psychological health problems. According to a publication done on pediatric nurses, it all depends on how much knowledge and experience a nurse has with obesity in order for them to inform and find a solution for the patient. It was found that a vast majority of nurses knew little to nothing about how to educate parents about their child's obesity, and therefore, the push for nurses to gain more insight can greatly impact the prevention and treatment of childhood obesity. It's known that obesity can take a toll on a child's mental health and can also increase their psychosocial problems. Therefore, nurses are often encouraged to take direct action towards activities that can help prevent the increase of obesity in the country. Parents are often in denial about their children's situation, but studies have shown that when working collaboratively with a nurse, it can help eliminate the miscommunication towards obesity. In some cases, nutritionists work alongside nurses in programs like the National Child Measurement Program, also known as NCMP, in order to focus on giving overweight children group sessions in which they work on physical activity and diet. Nurses are taught how to set guidelines and with parents, as well as help them promote motivational interviewing techniques when talking to parents. Since weight is often a sensitive issue, nurses are encouraged to engage in talks with the parents about healthy eating with their children. Every day, nurses and the lives they touch greatly increase, and without them, programs like the NCMP can't entirely reach out to families with histories of obesity. Thank you.